lecture number 17, Medical Emergencies in the Dental Office. As life expectancy does increase, so do the risks associated with providing medical and dental care to aging populations. Patients who have complex medical histories and extensive drug therapies on their medical history can present a wide variety of challenges to the dental team. The dental assistant must be able to recognize an emergency situation and have the ability to give prompt care when it's needed. So first off, it's important to take, as we've discussed before, a very good and extensive health history. It is medically and legally required that the patient fills out this medical dental history. Once in the treatment room, it is you, the dental assistant, who should review that medical dental history with the patient and check for its accuracy. Any significant findings should be presented to the dentist. And the most important aspects of the health history are as follows. To determine if there are any significant health conditions that could be impacted by dental treatment. To determine if there are any medications that the patient is taking that can negatively interact with the dental anesthesia. To determine if a patient has any allergies at all. And to obtain a contact person in the event that there is a medical emergency. Now, every office has emergency equipment and training, and it should be an emergency team that is established. So all dental offices should have the following readily available: an emergency kit, an oxygen delivering system, and an automated external defibrillator. Basic life support, CPR, and the use of an AED is required by team members every 2 years. All members of the staff, including the front and back office personnel, should be trained in basic life support. Remember that if you should be in need of help, always contact your doctor and call for help if needed, and don't hesitate. So what are different medical emergencies that can occur in a dental office? Well, syncope is the most common. It's also known as fainting. A momentary loss of consciousness occurring due to the decrease of blood flow to the brain. So how do we manage someone who faints? Place them in the dental chair in the supine position, pass an ammonia inhalant underneath the patient's nose, and monitor and reassure the patient until responsiveness has returned. Another common medical emergency is hypoglycemia. This is known as insulin shock, and it's caused by an abnormally low blood sugar. This can occur if it is a diabetic patient who takes insulin and skipped a meal. The hypoglycemic patient will appear nervous, disoriented, and even agitated. They may appear pale, weak, and even wet from perspiration. So the management of this patient is, if they're conscious, giving them something sugary, such as orange juice, can actually help the patient feel better almost immediately. If unconscious, call the EMS, put in a supine position, and basic life support as needed. Monitor their vitals and always administer oxygen. Another medical emergency is hyperventilation, rapid breathing brought on by a stressful situation, which occurs in the dental office. So a nervous patient will take deep, rapid breaths, causing an increase of elimination of carbon dioxide from the blood. So it causes alkalosis, which is an alteration of the pH of that patient's blood. So we put them in a supine position again, instruct them to slow their breathing. 4 to 7 breaths per minute is what is ideal. If the patient is unable to slow their breathing, instruct the patient to cup both their hands over their nose and take slow, deep breaths in their cupped hands. The exhaled air contains carbon dioxide, which will re-establish the pH. Another medical emergency is seizures. The management of this is to move any nearby objects from the patient to protect them, remove all objects from the patient's mouth immediately, never insert your fingers or any other objects in the mouth, contact emergency contact to transport the patient home after the seizure, and contact the EMS if the seizure does last longer than 5 minutes. Another common medical emergency is an acute asthmatic attack, also known as bronchospasm. This occurs when the bronchial tubes that are located within the lungs start to spasm. The management is always have the patient bring their inhaler with them to every dental visit. If they do not have an inhaler, you should have albuterol in your emergency kit. Administer 1 puff every 5 minutes. Contact your EMS if the attack does not stop. There are also allergies that can actually occur in the dental office, and it occurs when there's a sensitivity to an allergen or foreign substance developed within the person. If it's an acute reaction, you will see that the throat could become swollen and the patient is unable to breathe. This can be anaphylaxis, and this is very serious. Administer epinephrine immediately without hesitation. Antihistamines can be administered as a follow-up measure. Maintain that patient's airway, call EMS, and administer oxygen. Another common medical emergency is angina pectoris, where the narrowing of the coronary arteries that surround the heart can actually have decreased blood flow to that heart muscle. It's categorized by acute pain in the chest. So the management is return the patient to the upright position, administer the patient's own nitroglyceride by placing it under the tongue for 2 to 3 minutes. If the patient does not have their nitroglycerin, you can use it from your emergency kit. Administer oxygen, and if symptoms persist, a heart attack may actually be taking place, so call EMS immediately. That is the next one, the myocardial infarction, which is also known as a heart attack. This is the death of the cardiac muscle due to partial or complete blockage of the blood flow to the heart. The patient will experience intense pain in their chest, shoulder, neck, and even the mandible. Management call EMS without hesitation, administer oxygen or a 50% nitrous oxygen combination, nitroglycerin 3 times at 5-minute intervals, administer aspirin, it should be chewed and swallowed, and prepare to deliver basic life support and apply AED pads if applicable.